How bad is it? And tell me, are we likely to see a peak soon, or are things likely to get worse before they get better?
Thanks for having me on the show, Rishaad. Right now, India is not seeing the peak. I'm afraid we'll have to wait for at least 2 weeks to see the peak at the national level. While the states are having different starting points, so therefore different states will peak at probably different points of time. In the next 2 to 3 weeks, by 19th of May, we'll probably add 15 million active cases from now. So even at 1% of the total cases in the country, we might be requiring 15,000 beds with critical care. So it is concerning, it is grim as of now. As much as help globally and even internally in terms of redistributing oxygen and the other critical supplies, including medicine, is being taking place right now. We hope we'll tide through this with not major casualties.
Doctor, what perhaps may be worrying is that this wave is different from the first, is it not? And there are new strains of the COVID-19 virus which are alarming, which are affecting people who are younger too. There are also concerns about other strains, third mutations, if you will, and how they may not be responding to vaccines.
Yeah, so compared to the first wave, definitely there are more variants of concern at play here. There are three imported variants, which is UK, South African, and even one isolate of Brazilian strain isolated. In addition to that, there is a local B167, which is otherwise known as double mutant, although it is not exactly double mutant. It is found to be more infectious, but not virulent as of now. But because it's more contagious, more and more people are getting infected in a short span of time. Even if you take 5% of them requiring some kind of critical care, the health system is strained because of this sudden surge in cases. In addition to this, there might be other local variants. The genomic sequencing is being stepped up. We would know regarding these results maybe in the coming few weeks. This is why it is important globally to work with India in terms of stopping the transmission right now, because higher transmission means maybe newer variants of concern might develop.
Doctor, we're just flashing across the screen some more devastating numbers coming through out of India, and it could be a record. We need to clarify that. But India adding 386,452 coronavirus cases in one day. Tell us your concerns here too about the underreporting, particularly perhaps with deaths.
Yeah, so from what the reported cases of 380,000 per day, we might be soon touching at least 500,000 cases per day. Underreporting is a problem throughout the country to some extent, but in some places it might be greater. It's mostly because lack of health system infrastructure and resources and poor testing in some of the states with very poor health system. And probably there is also panic, there is also scare among the population in terms of either getting tested or to test because people just want to stay at home. And there is also delay in seeking both testing and care. So it is chaotic in some of the states with poor health system. Otherwise, overall, we can say maybe at least 1:10. For every reported case, there might be 10 unreported infections.
You say that it's not too late for India to come up with a better plan to tackle this. We are seeing help internationally to the US, Japan. Tell us how much more is needed and I guess what this means more broadly for the global pandemic.
Yeah, in terms of supplies, I think the states with poor health system where oxygen capacity is completely difficult to get, that's where redistribution of oxygen is required. Globally, I think there are more supplies probably can help in terms of oxygen concentrators, ensuring that there are other supplies, but most importantly, vaccines and vaccine-related raw material. If vaccines are ramped up, there will be another wave sometime in the winter. We should be able to prevent mortality and limit the morbidity in the next wave before Diwali.
How worried should the rest of the world be about what is happening, though, in India and how this could actually affect the global recovery, the overall stretching out of the pandemic as well? Because we know that a number of countries now are trying to restrict or close off flights from India, but it is a very worrying situation.
Yeah, Juliette, this is a very important question. So this is the time for global collaboration. The reason is high circulation in any part of the world means that there are chances of new variants developing which can actually upset the entire globe in terms of newer variants of concern. We can't shut our borders completely. So what we need to do is not just India, wherever there is high circulation, the entire global community has to get together and try to stop the transmission as soon as possible. At the same time, only hope for preventing any newer variants is vaccination. Even in India, the newer variant is shown to be, the vaccine is supposed to be effective against even the newer variant in India, which is good news. So more vaccination, at least for all the vulnerable in the globe, if they are covered, I think we should be able to do well in terms of the entire world's COVID-19 response.
Dr. Babu, the government there has come under a lot of criticism for allowing this to happen. Have they turned tail? Are they doing more? And what needs to be done? And are they doing it?
There are complex challenges here. The government did open up almost every sector, and there were many super spreader events from the beginning of the year. There was a sense that probably the second wave may not affect India to the extent that we are seeing now, because in the first wave, there was lower mortality, lower number of cases. So even if we ramp up at least by twice in terms of health system capacity and resources, there was a sense that we could be effectively managing this situation. But all the calculations were turned upside down with the newer variants of concern. And clearly, it is controllable situation. The government, both at the central and the state levels, are under increased scrutiny, both internally and from the outside world. But there's also a great sense of solidarity with more than 40 countries offering help, and even internally many volunteers stepping up in terms of whatever resolution can be possible. I'm sure we'll come out of this, but we should not forget chronic neglect of public health system is the main reason why we are in this place. We need to strengthen that in the longer run.